everyone, I'm Joyce the Dentist, and today I'm going to talk to you about how to take care of your dental veneers. You know, getting cosmetic veneers is usually a big investment, both in terms of your personal time as well as your budget, and you want to do everything you can to make sure that they last as long as possible. To protect your smile investment, there are specific things you need to do to take care of your veneers and also your surrounding smile. Whether you're considering dental veneer treatment or just had veneers placed, I'm going to review everything with you so that you know exactly how to take care of them. If you're getting traditional porcelain veneers, you'll have a set of temporary veneers while your final ones are being crafted at the lab. Temporary veneers are just that. They're temporary. They are not bonded to your teeth with permanent cement, and they're not as durable, so be very careful with them. For those 2 weeks or so that you're waiting for your final veneers, try to eat softer food textures and be really careful while you're brushing and flossing. In fact, your dentist may recommend a water flosser or to pull the floss out through the side instead of just up and down so that the temporary doesn't come loose. Now, every cosmetic dentist will have a different protocol. I have an entire goodie bag with very specific instructions that I provide for patients as well. Not to worry, your cosmetic dentist will review their preferences with you. Now let's talk about your final veneers. These are the permanent porcelain restorations that your dentist bonds into place about 2 to 3 weeks after your prep appointment. First of all, use a non-abrasive toothpaste to brush your veneers and other teeth twice a day. You really want to avoid anything overly abrasive since it can cause surface scratches over time and make your tooth enamel and dental work look a little less glossy. So if you're using a whitening toothpaste, double check the RDA level of it to make sure it's in the medium range and not on the high upper range. Number 2 might surprise you. Always floss around every tooth and veneer every day. A lot of people are afraid that flossing around their dental veneers is a bad thing. They worry that the floss will eventually pull the veneer right off the tooth. Just remember that your final porcelain veneers are carefully bonded to your teeth with a very strong dental cement. Cleaning around them with a toothbrush or floss isn't going to make anything come loose or fall off. But what it will do is keep those contact areas really nice and clean. That way you'll be less prone to getting a cavity around your veneer or on the adjacent teeth, because cavities can make your veneers fall off if they get too big. Floss is also important to keep your gums healthy since it slips right underneath the edge of the gum line to remove plaque that your toothbrush can't reach. All you have to do is gently shape the floss in a C shape around the tooth and slide it up and down the side a few times. You want to do that every day around every veneer. I also love water flossers for post-op veneer care. They do an excellent job of keeping the gums healthy. Tip number 3 is to wear a mouth guard or a night guard as directed by your dentist. I simply cannot stress this one enough. If you are prone to clenching or grinding your teeth or are involved in some sort of athletic activity, you need to take the steps to prevent fractures in your veneers. Wearing a custom fitted oral appliance will offer the best level of protection. A custom fitted appliance also tends to be more comfortable, so you can count on it staying put when you really need it most. Your mouth guard is going to take the brunt of any bumps or teeth grinding, lowering your chances of broken dental veneers. In fact, I make a night guard for every one of my veneer patients mandatory, and I include it into the price of their veneers. My 4th tip is to take good care of your gums and the rest of your teeth. Your dental veneers are only as stable as the teeth that support them. If you happen to develop gingivitis around your veneers, it will encourage bacteria to build up around the margins of your restoration. Not only can that predispose you to cavities under your veneers, but it can also lead to gum disease, or what we call periodontitis. Periodontitis makes the bone around your teeth dissolve, causing those teeth to become loose or even fall out. So always take really good care to make sure your gums are healthy. That way you have a nice, strong foundation for the whole tooth as well as your veneers. Tip number 5 is don't bite into anything too hard or use your veneers to open things. That means no biting your nails, ripping open packages, or even using your front teeth to bite right into a carrot. Veneers are strong, but they aren't invincible. Enamel is the strongest substance in the body, and even that can chip. So can porcelain veneers. Finally, tip number 6 is to see your dentist. Ideally, you want to see your dentist for a checkup at least twice a year. During these visits, you'll have your teeth professionally cleaned, get screened for cavities and gum disease, and have x-rays taken to pinpoint smaller issues so that you can get ahead of them. If your dentist does see a concern beginning to form around one of your veneers, you can make some changes in your home care routine before a major issue develops. And before you leave today, it's important to consider that, like every other dental restoration, Even veneers can wear out and eventually need to be replaced, but the better you care for them, the longer they typically last. And if you haven't gotten dental veneers yet, be sure to check out my video about the 5 reasons why you shouldn't get veneer treatment. Until then, smile smarter, everybody. Bye!